this is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator, and you are watching Aging Strong, which is sponsored by the Quincy Health Department. Today, we have a guest speaker. He is a physical therapist. His name is Keith Foley, and he is with a company called Joint Ventures. Keith, welcome.
Thank you, Debbie. Thanks for having me. I've been excited to do this and speak about fall prevention, which is a very, very important topic affecting the older adult.
Yeah, definitely. Definitely. I always love having physical therapists on the program because, a lot of us can use many simple ways to help us become stronger. And I know you've got a presentation for us. And as you're, putting that on for us, I know towards the end, you'll be showing some exercises. So, viewers, make sure you hang in there and watch the whole program. But Keith, why don't you upload the program, our presentation?
All right. And yes, like you said, we will be doing some exercises towards the end of the presentation, but I think it's important to know why we're talking about fall prevention and why it's such a big issue. Mm-hmm. And that's what we'll start with.
Yeah. Fall prevention is such a big issue. Like you said, it's a problem not just in our area, but also across the country and all over the world, especially as people are getting older.
And this is part of the statistics that I wanted to start with, right? So falls are the leading cause of injury and death in adults over the age of 65. And especially as we're experiencing in New England weather in the winter right now and ice and snow, I'm sure it's top of everybody's mind. And when you put it like this, that 1 in 4 older adults will fall each year, and we have 14 million Americans, you can imagine just a quarter of that, 3.5 million Americans will sustain a fall and injury during the year. 20 to 30% of all older adults who fall will sustain a serious injury. And that will have to do with going to the ER visit. And there's 3 million ER visits per year just as a result of fall. So that just kind of highlights just the presence and the severity in our population of just how many people this can reach and affect. And I think
before you go any further, can you we don't see the presentation. I know you've got a beautiful presentation.
Oh, okay. Yeah. Did I not share the screen? Sorry. Here are our statistics. So like I said, falls are the leading cause of injury and death in adults over 65. 1 in 4 older adults will fall each year, and 14 million Americans. That's quite a large number. 20 to 30% of older adults who fall will sustain a serious injury, and that leads to 3 million ER visits. We know they're not $1 a visit, so you can only imagine how much that is. 3 million ER visits per year are a result of falls. I think that just, again, highlights just the severity and just how much it burdens our healthcare system and how much it can impact those who we care about and love. The biggest one that we have a lot of research and data on is the hip fracture in the older adult. And what it shows is greater than 80% of hip fractures related deaths were a result of falls. Mm-hmm. So it's very important when you sustain this injury and you fall and you fracture your hip that you have early mobility and you resume walking and exercise and strengthening as soon as possible, because it's not only the fracture that kills you, it's the subsequent comorbidities and things that happen afterwards. And as we know, with absolute rest and bed rest, you can really deteriorate quick. And the other thing we've learned a lot in our industry is about bone healing. And what we know about bone healing just in general is stressing the bone is important. So when you do have a fracture of any type, or even we can touch on osteoporosis as we go, loading and weight bearing is very important to stimulate the cells to repair so that we can get back to where you are. So sometimes it's a little tricky. You're in pain and it's very difficult, but the movement and weight bearing and ambulation is super important early on with these fractures. The expected costs per year due to falls in the older adult are expected to rise to greater than $100 billion by 2030, which sounds far away, but really it's only 5 years from now. The other, we talk a lot about fractures, but falls are the most common cause of traumatic brain injuries, along with the hip fractures in the older adults. So very important to kind of take all the preventions that we can to make sure that these things don't happen.
Yeah.
So where do people fall? And this is interesting when you actually look at some of the research and data that 25% of the US population, the falls occur in parking lots, which, again, this time of year is why it's very important to salt your parking lots, make sure that there's no ice, but other things, environmental hazards like curbs and faulty ramps and different things can lead to it. So you always got to be aware, especially when you're in a new environment, of your surroundings, because those things can lead to falls. 60% of falls in the older adults happen inside their home, right, in their living area. So, and then when you look at the data, you can break it down even more. Like the bedroom's the most common. Living room's the most common, followed by bedrooms. Obviously, two places we probably spend most of our time. Kitchens, and bathrooms, which you would think are a little more slippery and could lead to falls, but a little bit less in the kitchen and bathroom. And then the hallways, 10%. Nearly all falls in older adults are sustained while performing activities of daily living, like toileting, bathing, dressing, walking, and negotiation of stairs. And the reason why we highlight that is a lot of times I think people get concerned when they're doing things that are not their routine daily habits. But a lot of times when that happens, your attention, your focus is so great that you're a little bit at less of risk to fall. A lot of these falls happen with things that you do each and every day because you're not as focused on it. Of the falls that occur outside of the house, I think it says 30%. I have this thing in front of me. I can't say 30% of older adults fall near their house. I've just had treated all morning and had two people who fell recently, and both of them were actually, one was on the street right out in front of their house, and the other one was in their own driveway. So very common, even if it's not within your house, it is, close or near your property, which is where these things happen. So something to also be mindful of. A little bit of back and work on kind of what controls your balance. We have three major systems that influences your balance as we age and just at any age. One is the visual system. One is the vestibular system, and one is the somatosensory system. So the visual system is obviously your eyes, your sight. And I think, if anybody's ever closed their eyes or been in a dark room, you realize just how important your vision is to orienting you to your environment and where you are. The vestibular system is a little lesser known, probably popularly. Vestibular system is your inner ear, and it can kind of lead to your equilibrium. So one thing that's very common, people have like bouts of vertigo, but even like other degenerative changes to the inner ear and brain can lead to some, instability. That is something we can also train during physical therapy with graded exposure. And then the last one is the somatosensory system, which is joint positioning. And, you get that from where your body is in space. There's sensors and receptors in your joints, your ligaments, your tendons, your muscles, that gives information to your brain so that you know where you are in space. And then also like pressure, skin sensation from your feet, which with neuropathies can be limited, and that can also put you at risk for falls. But the other thing about the joint positioning, another reason why exercise and movement helps. The more you challenge that system, the crisper it is, the better it is. So now we'll get really into strength and power or rate of force development, but just moving and consistently challenging your body does help with your balance because you're doing things that keep these systems sharp. All right. So winter is here. It's not even approaching. We had a nice little snowstorm this past weekend. So it's a time of year that's, I think, falls are top of mind on a lot of people with the snow, ice, and sleet. And then even when you go inside, wet floors. The other thing, like we were talking about the visual system, is reduced daylight time. Luckily, it's starting to get a little bit lighter past 5 o'clock now again, but the dark nighttime does also kind of increase your risk for falls and loss of balance. So one thing we think about as physical therapists when we're doing an intake and evaluating somebody is like, what are some modifiable and what are some non-modifiable factors? So a couple things that, are a little bit out of our control, obviously, is age. Father time is counting down to all of us. There are impaired sensations from diabetes and neuropathies that we cannot address, right? So we have to kind of work through them and work around them. There's progressive neuromuscular conditions that we can, again, minimize the rate at which they degrade, but we cannot prevent them or stop them from happening. And then there's chronic diseases that are outside of our scope as physical therapists, cardiac disease, strokes, dementia. There's things that we cannot affect. So we have to also think about those when we come up with a plan of care and take them into account so we can maximize what we can control. Then there's hidden obstacles, or what I like to call like environmental factors. Black ice, you may not see it. You may be kind of walking and then it's there, and it's not something you could be aware of it, but you can't prevent. And then some of these other progressive neurological diseases like the Meniere's disease with the inner ear, which kind of affects that vestibular function, and then impaired vision that's not treatable with any sort of care. Now, the last bullet, a past history of a fall. That is actually one of the best questions we can ask. One of the highest risks for a future fall is a previous fall. And you could almost boil it down. If you ask somebody, have they fallen in the past 6 months, that puts them at an elevated risk factor for falls. So that's a very important question that we always ask. Doesn't mean you can't prevent it, but like it is an indication that this is of the utmost importance, that we need to work on this so that you kind of get out of that window of 3 to 6 months of a fall.
Hey, Keith, why do you think that is? People who have fallen in the last 6 months are more likely to fall.
Well, it could. There's a lot of reasons. My current understanding is that when that happens, there was probably something led up to the initial fall, right? And there's also falls that you trip over something and it's a one-time kind of deal. But was the original fall because of loss of strength, loss of power? Was the original fall because of the vestibular system? And then what happens is then the individual justifiably gets concerned, anxious, and then kind of closes their world in on them, right? They stop doing certain things because they're afraid of falling again. And that's a short-term strategy that long-term is very problematic, because it leads to deconditioning. It leads to not challenging your body with those proprioceptive somatosensory conditions. And I think that those two things combine to lead you to be at risk of a fall. Mm-hmm. Does that answer your question, Deb?
Yeah, it makes sense because, typically people, when they fall, depending on how the severity of the fall, if it's just a little thing that they catch themselves, some people don't even call that a fall. But if it's severe enough that they ended up in the hospital and maybe needing surgery and then rehab, then, that becomes more, it stays with them much longer. It changes their life.
Absolutely.
And not only are they now suffering from pain as a result of the fall, but it changes their level of independence and also changes their confidence level and to be able to get up and walk around by themselves. So, to your first bullet here in this new slide, fear of falling, that becomes the next obstacle, because then people are less likely to move around like they normally would, which, like you said, leads to deconditioning.
Yeah, absolutely. And like I had a woman this morning that I worked with that she fell last winter due to ice, and unfortunately had a long road because of a broken ankle and then subsequent knee pain and other things. And, even though it's been a year and she has not fallen in the past 6 months and she's doing really well, gotten to the point where she's not walking with an assisted device anymore and just like completely independent and doing excellent, she's still fearful, right? And there is a part of that that's normal and healthy, but as long as it's not emerging to the point where it's interfering with your life and your quality of life, that's a very important thing. And then the other thing we always talk about as far as confidence, a lot of strength training early on in many arenas, doesn't matter if you're here for back pain, neck pain, knee pain, or for falls. The beginning of strength training, a lot of it is confidence. Your body is just getting confident in tolerating certain positions, certain weights, and certain movements. So exercise has a lot of benefits, but confidence is one of those. So some of the other things that we were talking about that are modifiable that we want to address during physical therapy in our sessions is that fear, and having these types of conversations can be tremendously valuable to the individuals we're working with, and just starting that conversation, giving them a window into how that can affect their life and how it's affecting their environment and the people around them is important. The other thing we spend time, especially early on, is the home setup, right? So we dig into their homes and kind of strategize with them different things that they can do to decrease the risk of falls. So carpeting, meaning like area rugs, is one of the easiest things to like modifying, either get rid of or like shore up with tape or things that they're not getting kind of caught. And then thinking about the pathways, the common pathways that people are in, keeping them clear. Especially one thing I spend time with is like at night, if somebody has to get up and go to the bathroom, which is common, let's make sure you have a clear and unobstructed path, because that's where a lot of these injuries can occur. You know, due to the waking up, being a little groggy, lack of light, all of these things that is a common time that people fall and get hurt. So we talk about strategies for that. We talk about the different types of flooring, right? Because, you know, carpet versus hardwood makes a big difference as far as footwear and what's going to slip and put you more at risk, right? The socks on a hardwood floor are very dangerous. Do your stairs have runners? Do they have carpets? Do we have like traction on there? It's another big part of that. And then lighting. Lighting is something you go through. And some of these, you know, my philosophy is start with the easier ones that are low-hanging fruits that we are inexpensive. And then we can kind of raise as we go. Shoe wear and clothing, spend more time with shoes, but like talk about clothing that are not going to cause you to trip. You know, loose pants, long pants that are properly fitting is important. But shoe wear, it's up to the individual. So, you know, if you're, it's more about comfort and traction. We just want to make sure that people don't have shoes at the bottom that don't have traction and can make them, especially with a little bit of moisture, very risk for falls. Another thing to think about is the medications, right? Along with the question of falls within 6 months, another question that is very easy to ask during the evaluation is how many medications you're on. And if you're on 4 or greater, that puts you at an increased risk of falls. And something to talk about, just to be aware of. And then also, like, you can work with the PCP if we can modify some of those if the falls are increasing. And then obviously drugs that kind of affect your mind, that can definitely affect your balance. Assisted devices. So I know some of the hardest things to do at points is to have at somebody at any level. I can think of young athletes that I work with after a surgery that do not want to use an assisted device, to the older adult where maybe they would benefit from a cane or a walker. It's a difficult conversation to have. And a lot of times I like to pose as far as like maybe short term, this is something we need to do so that you're safer. We can get you to be more active, build up their stamina, build up their endurance. And then hopefully as they do that, we can wean off of it. But assisted devices are important. The tests underneath are just some ways that we as physical therapists can gauge if an assisted device is appropriate for you. One is the Berg balance test, which can take a whole session. There's quite a few items to do in that. And then 2 of my favorites are the 5 times sit to stand and the tug, which is called the timed get up and go. And they're a great indication of your strength, power, and your ability to change directions. And then we're going to get into the exercises, but we always, as physical therapists, assess strength, flexibility, range of motion, and we'll do some like tests of your balance. And then we can, to a certain extent, check visual systems. But again, if they're significant enough, that's where, us as physical therapists, it's important to have an ecosystem around us of different doctors and healthcare professionals, but we would refer out to somebody that could further work up the visual decline. All right. Well, that was twice. So another thing I think that is important to talk about before we get moving is what to do in the event of a fall. Sometimes these things happen and you can prepare the environment, like I said, as much as you can, be mindful of things, but sometimes things just happen. In the event of a fall, when you kind of come to, you just want to take a few deep breaths and kind of slow down. I think when these things happen, our adrenaline can be going and we want to rush, or if it happens in a public place, it's a little embarrassing to fall and you kind of want to show that you're okay. But sometimes moving quickly after a fall, it can cause additional harm. So you take a few deep breaths and kind of take a sense of your body. Is there a spot that you landed an impact? Is there a spot that you feel significant pain? And if you do, you want to acknowledge that, because traumas are impactful and you don't want to compound things. The easiest way, and I'm going to demonstrate this, to get up is to roll onto your side, and then you transition to your hands and knees on all fours. And then you can crawl to a bed, a chair, a dresser, something that's pretty sturdy if you need assistance to use your hands to get up. And then once you do that, you put one foot in front of the other and you're kind of in a half kneeling position, and you use your legs and arms to pull up and push up into a standing position. One thing, you can apply ice to sore areas to reduce pain and swelling. It's a easy thing, and I think pretty common sense. But if you have pain with weight bearing, or you're unable to put weight through a leg or an arm, that is a pretty strong indication that you have a bone injury that you want to, either go to the ER, urgent care, or call your MD and get assessed. It's better to get assessed and be cleared. I think every doctor would tell you that, rather than kind of letting something linger and maybe possibly worsening it and delaying care. Mm-hmm. All right, so we are gonna exercise. All right, so there's one thing about exercise as a physical therapist, Debbie, is there's a lot of different ways to roam, right? The exercises are in some ways interchangeable. What we always ask ourselves as physical therapists is, what is our goal and what is our intent? So our goal with these exercises today, for the context of here, is I'm going to do this assuming people don't have a lot of equipment at their home and they just have some simple household items. And even with those household items, there's some really effective strengthening that you can do to help prevent or minimize the chance of falls. Okay. So we got my treatment room here, and we got a little bit of space. So the first, and I think the most effective exercise, if I only had somebody do one, is called a chair stand, or what we would call a box squat. Okay. So one of the tests that we use to see if somebody's at risk of falls or needs an assisted device is the 5 times sit to stand. And what that is without using your arms or legs, you just get up and then sit back down 5 times as fast as you can. So the exercise to do at home would be to take a chair, and the key would be to put it up against something sturdy. So you put it up against a wall or a very sturdy piece of furniture that you're not going to hit your head on. And what that does is, if you're kind of lose control and go backwards, you're not going to fear that the chair is going to go back, right? But just for the purposes of the view, I'm going to do it from the side. And the first one is just like a simple box squat. Now, at first, you can just practice, can you do it 8 to 10 times without using your hands, okay? And if you can, then what I usually have people do is work on speed at which they do it, all right? So then if you can do comfortably 8 to 10, then it's, can you get up quick and then down slow? Up quick and down slow. So that works on 2 things. One, it works on power or rate of force development, which is very important for balance. And two, the slow lower works on eccentric strength for your quads. Okay. And, physical therapists were always assessing. One thing that we'll see a lot in this population is the tendency to kind of get out of the chair like this. That they dive really far forward and then they come up. And what that shows me is it's really hard for them to use these quad muscles, right? So they end up using a big trunk strategy to get up instead of kind of really driving down through their legs and coming up like so. Because one thing that, again, people will be like, oh, this is such a kind of a boring exercise. But myself, if I'm doing even weighted squats, it's the same motion, right? You're just using the chair, to cue depth and also to be safe with it. So typically with that, I would have people do, 3 sets of anywhere, depending on their level, from 5 up to 12 repetitions. And then another thing that you would eventually do is you could just hold a weight, right? So if you had any sort of weights at home, you could just hug it in front. But honestly, a lot of people don't have weights. So, I got really good at this during the pandemic. I'll just demo with a pillow, which is obviously light. But they could get like a bag of something, maybe put laundry detergent or something with some weight in it. And then they just hug the bag with some weight and they do a similar exercise. So that would be the biggest one. Now, like we were talking about, balance and power are related. So power we define as like the speed of which you do something, right? Rate of force development. So you can move the same weight at different speeds, and depending on how fast you do that, you can focus a little bit more on that power or rate of force development. And the reason why that's important is when you have a loss of balance, let's say. You're walking and you have it's not so much the ability to step and then come back is the important thing, right? So when you fall or you have a disturbance of your balance, the correct reaction would be to step. And a lot of times people don't have then like the strength and the power to actually change their center of gravity and their center of mass, okay? So these next 2 exercises are really something that I use with a lot of populations to work on that ability, okay? Now I just have a foam roller, all right? But at home, it'd be great if somebody had like a column, okay? Something that's a little more sturdy, or a railing of some sort. A lot of people, what I have them do, if you can imagine, is like in their door frames, I have them use just like the frame of their door. But what we're gonna do is you get in a lunge or like a staggered stance position, okay? 1 foot in front of the other. And at first, all we do is kind of shift our weight forward and back, right? And as you can see, as I'm doing this, I'm shifting my center of mass, which is my trunk, from the back leg to the front leg. And the reason why I have this column, or why I like the feedback here, is similar to what we were saying. I don't want people to use a trunk strategy that they're kind of leaning forward like this. I want them to shift everything over this leg and this quad and knee and then be able to push back. So a lot of the work is getting done in the leg. And you can use this as feedback that you're seeing your knee and your trunk getting closer to the column and then away. Because if you're shielding and not doing it, you'll see that your knee kind of stays the same, but your body's going towards it. And that tells me you're not comfortable or strong enough to like put that weight in that leg. And there's a progression of this. So, and the other reason I like the column is like, as you're challenging your balance, if you lose it and you need to grab, it's also there, right? So you want to create an environment that people feel safe to do these things. But the progressions go like this, that you'll shift forward and back. And when you feel comfortable doing that, again, anywhere from like 8 to 12 times, you do it on both legs, all right? Then the progression would be you actually take a step and then step back. Take a step and then step back. And can you do that comfortably on both legs, okay? And then there's a similar progression. Then if you feel comfortable there, then I'm cueing intent and speed. It's like Can you do it and really push back quick? Can you do it and push back quick like that? So that's another simple one that you can do, again, using some sort of external feedback for the weight shifting. Now, not everything goes forward and back. The other one I like to do is just like a lateral lunge and reach, all right? So again, I'd probably have somebody start at a counter of some sort that they feel comfortable that if they lose their balance, they can grab. And then it's just step out, reach across, and then back. Step out, reach across, and back. So now I'm just moving my center of mass to the side and back using my legs. And it doesn't have to be this like really deep lunge. It just needs to be a little bit of a weight shift, weight through the leg, and then back. And then I'd like to add the reach in for a little bit more of a challenge, kind of reaching outside the base of support. And then you do that to both sides. So then we've worked on going forward and back and side to side. One fun thing sometimes we'll do here in the office is I'll put different colored objects in front, like cones and balls. And we can play, like I'll call out a color and say blue, and you step to the blue. And then I'll say red, and then you step to the red. And you kind of, again, now we're working on some of that cognitive stuff too, reacting quickly and changing directions. And that can be a really kind of fun exercise to do here in the office. I wouldn't have anybody do that at home just because of the setup first off, and then also like the safety aspect of it.
Keith, why is it important? People might be thinking and wondering, why is it important to do the side to side lunges when, we tend to walk forward? We're always
good question.
Forward. So what's the significance of having to do the side to side?
So the side, we do walk forward, but falls in when you trip and you will step to the side. So you want to have the stepping and righting reaction to multiple planes. There's also importance of strengthening your hips with that, or you can think of something as simple as like stepping into a bathtub, or there are certain activities that you will do sideways. So it's important to have one principle that we believe in here is like, we want the human body to have as many options for movement as possible. The more variability you have within the system and the less redundancies, the better the body operates. So if you only have one strategy going forward and you're really good at going forward and back, the few times that you have to go in another direction, you're just not going to be prepared for it.
Mm-hmm. Yeah, well said. Yeah. Thank you. Yeah, like maybe if you are going to a baseball game and you have to kind of walk sideways to get to your seat, or church, they have to kind of walk sideways to get to this
any sort of crowd. Yeah, like you're in a mall or something like that, and something appears in front of you, you got to have some ability to go around. Mm-hmm. And another one that we do, which I didn't, because it involves an equipment, is like just like a easy like step up and over a step laterally. You kind of step up and over a step sideways. And that's a really great footwork, and we kind of work on speed of movement with that too. Mm-hmm. And then the other, so that I think those first three exercises are very important, and I like them because they multitask the change of center of mass and the stepping reactions, and then the speed with the box squat. But the last three I'm going to go over, or four. Are pure strengthening exercises that are very easy to do at any home, because all you need is a wall and a counter and maybe a step. All right, so the first one that, if you remember, we talked about getting up from this chair, was that a lot of people will dive forward and kind of come up. So one of the best ways to strengthen your quads and your legs is something called a wall sit, right? So all you need is a wall that's nice and sturdy, and then you walk your feet out about a foot, and let's say you just have your feet about shoulders width apart. You keep your tailbone against the wall, and then you just slide down to a challenging depth that you feel like you can hold for, at least 10, maybe 15, gradually trying to get up to the point where you can hold and own this position for a minute. We use this exercise in many different forms with the older adult, but also people coming off knee surgeries and just general leg strengthening because it's so effective. And what I usually have people do, because the challenge that people is like, you don't have to get out of this exercise gracefully. So usually I'll have somebody use an object that's sturdy next to them. And they slide down and then say, 20, 30 seconds, like, oh, I can't get up. There's nothing wrong with doing that to get out of it. The exercise itself is really just the hold. All right. So with the wall sit, it's nice to have something to make you feel confident that you can push yourself to the limits. Okay. And I'm a big fan with all these things, and maybe we can talk about this after or give some material out after that. At least 2, if not 3 sets of each of these exercises. This one, I try to get people getting to the point where they can at least hold it for 30 seconds, if not longer, I think is a good bout. Because you got to remember also when you're going downstairs, these muscles have to be strong enough to help control your body weight, right? So that's another area why the quads are so important, not only getting in and out of low surfaces, toilets and stuff, but when you descend a stair, you have to be able to control your body weight on these quad muscles. The next one I'm going to do is just involving a counter. So I'm going to use my treatment table, okay? But let's say this was like a kitchen counter, okay? We're going to do a push-up. So push-ups are really important for upper body strength. And you may be saying, Keith, this is a fall prevention balance exercise. Why the upper body? And the reason I believe it's important is, one, a lot of times when people fall, they'll put their arms out, right? So like you do need some strength to do that. And then we talked about pushing up. Bone health is another big thing that I'm a big proponent of. And a lot of times people don't weight bear enough through their arms. And push-ups are an excellent way to do that. So those are the 2 main reasons why. It's like if we do fall, I don't want you to be at an increased risk of breaking a wrist or a shoulder or something like that. And then 2, it's just really good for your bone health and your upper body strength. So you get this up to, this is probably a little low, but like you use your kitchen counter. And then from here, you get your hands about shoulder width and you get into a plank to start the top of a push-up. So the way I think about it is the angle from my trunk to my arm is about 90 degrees here. And then you're up on your toes to do the push-up, and then it's just down as low as you can, and then push and punch out. And this is a nice, easy way to develop some upper body strength at home. And I would do same type of thing anywhere from like 3 sets of like 5 to 12 repetitions. And if you get to the point where like 3 sets of 12 of those is getting really easy, then you can start scouting out in your home. Is there a surface that's a little bit lower? Is there a surface that's a little bit lower? And continue to, the lower you get, the more challenging it will obviously be. The last 2 exercises are going to be specifically for your foot and ankle, which obviously is very important for falls. And having strength in your plantar flexors, which is your calf muscles, are one of the most important things. So I'm just going to use the step stool, but you can also, at home, if you have a case of stairs, you can just do it at the bottom step, right? And you always, I think the most common mistake people make with calf raises is they'll do them without holding on to something, right? And it is not, this exercise is not designed to like challenge your ability to be on your toes. It's to develop strength of the lower leg. So I want you or anybody to hold on to something when doing it. So I'm just going to use the wall, and then you just get off the edge of the step and you go down and up. And the other thing that's nice about doing it off a step is you get a stretch of your ankles at the same time and work the muscle through the full range of motion. The biggest thing that we look for with compensation with this is making sure that your head is going towards the ceiling, right? So that you're not like leaning forward or you're not like bending your knees. You want to think head up to the ceiling and then back down, just like so. And what I like to get people up to with this is about, let's see if they could do 3 sets of 20 to 25 because your ankles are designed and your Achilles are designed for a lot of repetitions. So you want to see, can you get up to 3 sets of 20 to 25? And if you can do that, that is a really good thing. But then we can start to challenge if you can do it on one leg. So then it would just be the same thing that you would be off the edge with one foot and you would go up and down on one foot. But honestly, I've been, lucky enough to work in this industry for about 20 years. And I worked at a couple different places before this company. I worked for Spalding, and I've seen a lot of older adults, and this is it's a muscle group that is severely deconditioned. You would think because you're walking and on your feet that these muscles would be stronger, but if every older adult could do 3 sets of 20, 25 of those and just focus on that, it'd be very, very valuable. Because I've seen people, it's very hard to get that strength back once you lose it.
Keith, yes. One second. So that particular exercise, does that help minimize? Sometimes when people are deconditioned or they're just used to walking around certain type of footwear, they tend to shuffle. Mm-hmm. So that particular exercise, a toe raise, would that remind them to kind of pick up their feet so they're less likely to trip over themselves?
Yes. So you're actually leading me into the next one, which is the toe raise, right?
Okay.
But this will also help because when you're stretching your toe up off the edge, that will help with the range of motion. So that will definitely also help.
Great.
The toe raise, what I like to do with the toe raise is, again, you lean against the wall and you put your feet about a foot or so away from the wall, and you balance, and then you just lift your toes up and down. So you're lifting your toes, getting onto your heels as high as you can, and then down like that. I like that better than holding onto a chair or something like that, because people, when you do that, you can kind of like cheat by leaning forward and make it a little bit easier. Now, obviously, if you don't feel comfortable, or if I was assessing somebody and they couldn't lift their feet up in that position, then I would do it just kind of standing like so. And then same thing with this. With this, because of the range of motion aspect, I'm a big fan of doing this like 3 sets of 12. But when you get up, you hold the top position 1, 2, 3, and then down. Because really, we're trying to teach you, to your point about shuffling, to be able to get that foot up. So I like to hold the range of motion at the top point.
Mm-hmm. Wow. These are great exercises. And, as I was watching you just now, I can't help but think, some people might be watching this and wondering, okay, maybe they're not strong on their feet. What can they start with if they are more comfortable sitting down? What are some of the modified version of what you just showed?
Good question. So you can do, what I would do is, if you're sitting down in the chair and doing a calf raise, it's good for circulation, okay? But it's really not enough of load for strength. If you think about it, you really literally only have like the lowest part of your body, and there's not a lot of weight above it. So good for circulation, not so great for strengthening. But what you could do is, this is where, again, I only have a pillow, but you could add an external, let me just actually have a weight right outside. I'll make this. So what you can do is, you don't have to have a kettlebell like this, but you put a weighted object out onto your knee, and then you do it. And I would do one leg at a time, because not to get into levers and physics, but this is a very uniquely designed joint with your Achilles, that it's designed for a lot of force. So, we look, let's say with runners and athletes, we look for them to be able to produce 2 times their body weight of force through this. So, 10 kilograms, which is what I have right now, is not sufficient enough for long term, but it's a good entry point, right? So if this feels challenging, to get you to do, let's say, like, again, 20, 25 of them, and you do it on each leg, over time, that could help you gain the strength to do the one standing. Now, back to the toe lift. Sitting is going to be tough because your knee's bent. Your ankle's already kind of at a 90-degree angle. So you would have to kind of walk your feet out a little bit and then do the lifts up. And I would, just like I was saying for the standing, I would work on holding it up 1, 2, 3, and then back down. This could also be a case to use a band if you like that. If you didn't have, and they're pretty easy to get, but a resistance band, you could like loop one around the bottom of the foot and put a loop here, and then I could work on lifting my foot up with some resistance that way too.
Good point. Yeah.
Rick. Those are all great questions, but any other questions?
Well, just like you said, it's wintertime here. We're located in Massachusetts. I had a call last week. Good friend checking out his spot, slipped, texted me, you have a minute? I'm like, sure. I slipped and I got back to my condo and I'm in pain. What should I do? Call 911.
Yes.
Yeah, you need to seek help, especially luckily for him, he just kind of bruised his greater trochanter, which is the side of his big thigh. He didn't hurt himself, thank goodness. But there are some people who would slip and fall and hit their head. Even more, if you hit your head, it's really, really important that you seek medical attention.
Can't underestimate that enough. And I think, there's a lot of somebody who works in it, a lot of issues in healthcare, and I can understand how people don't want to be bothered at points and times. But after a fall, it's not a time to mess around. You really need to get assessed, get checked, because you're right. These head injuries can be sneaky, and there can be a small bleed or something in there that you don't maybe perceive at first, but then is a devastating injury long term, right? And even your friend, it sounds like he had good, strong, healthy bones, because landing right on that trochanter is exactly how most people would fracture their hip. So you could have pain and it's like a hairline fracture or something like that you don't realize, but it could, gone untreated, can be a bigger issue in the future.
Yeah, definitely. I mean, you mentioned a lot about different risk factors for falls, having 4 or more medications. So, again, going back to, if you fell, hit your head, what if, a person's on blood thinners? So even more, you're at higher risk for brain bleed. So it's always good to get that checked out. I really appreciated all the different types of exercises you showed us. It looks like you really highlighted the importance of, you kept saying strength and how that is so important. And I love how you mentioned that, because typically people would say, would talk about balance and coordination. And yes, strength is mentioned, but not as highlighted as you did today. And it looks like one of the biggest muscle group that we really need to pay attention to are the quad muscles, right? For sitting, going down the stairs, like you said, getting up.
Absolutely. Quad muscles and those calf muscles are probably the two most important. I mean, I always talk to people, because people will say, "Oh, my balance is off," and a lot of times they self-diagnose it just with the ability to stand on one leg, right? Mm-hmm. They'll say like, "Oh, my balance is off. I can't do this." Mm-hmm. But what we don't appreciate is when I'm standing on one leg, my hip muscles, my foot muscles, my quad muscles, all of these, my trunk muscles are all working to own that position. So that is very much a strength issue when you can't do that. And, in this is a lot of different injuries, but if you don't have the strength, there's no point to moving on to some of the other stuff, right? It's the foundation of what we have. And one thing we know about the older adult, there's a normal age-related process called sarcopenia, which is the wasting of muscle mass. Now, we can't, again, prevent that, but we can minimize the rate at which it occurs with strength training and nutrition. And one of my plugs to middle-aged people and younger people that I work with is I try to get them on a strength training program after their injury. It's a silver lining. And I talk about stockpiling muscle mass earlier in life, because the more you start with, the longer it's going to take to degrade.
I love that. I love how you mentioned that. That's so, so true. That goes along with men and women, right? Sarcopenia. And that's why we tend to kind of like, when we think to ourselves, how come I can't open this jar of pickles? I used to be able to just kind of do a twist, and then here I go. What's going on with me? But it's part of the weakening of our muscles. So I'm glad you mentioned that, and also the fact that you talked about how the importance of strength exercises for the upper extremity, not just lower extremity, because when we lose our balance, sometimes don't we tend to kind of want to grab onto something to kind of catch our fall, right?
Absolutely.
Yeah. So very, very important. So is there anything else that we're almost at the top of the hour. What's the one or two things you want people to take away from your presentation?
Absolutely. I think we're summarizing it pretty good. I think I want the takeaway to be strength training is important, right? And even if you don't have a pain or you don't feel like you're at risk for falls currently, I think it's important for every human being to be challenging their body and doing strength exercises in some form 2 to 3 times a week. The other part is like doing those simple things like a 5-time sit to stand. If you're having difficulty with these things, or you feel like you're closing down your world and not doing things that you enjoy, or not going to places that you want to go because you're afraid of falling and afraid of how your capacity is to challenge those things, I think that in itself is a reason to pursue physical therapy and talk to your doctor, because we would rather get out in front of these things early on, because it's a lot simpler to fix and a lot more cost effective than to wait for the fall, right? And to wait for something like that to happen. So yes, so those would be my two, like strength and fear and apprehension and mindset around it. If you really feel like your mindset is slipping and you don't feel confident, it is more, you don't have to be shy. We will, that's part of our job, is to help you understand that that's normal, and we can help. We do have the skill set to help you with that.
I love it. I love it. So I really appreciate that. I'm glad to be able to connect with you. So how can people learn more about the exercises, or if they have any questions? What is the contact information? Where do you want to lead them to?
We're Joint Ventures Physical Therapy. We're located Southern Artery, right in the shopping center with Jersey Mike's and Convenient MD. We have a website, jointventures.com, and you could access the Quincy office through there. We're a local Boston company, and this is our first office kind of south of the city. My name again is Keith Foley, and my email is on the website, but I'll say it quick if anybody wants. My name, keith.foley@jointventurespt.com, and feel free to contact me with any questions, inquiries. Like I said, we welcome walk-ins, stop by the office, but we're big about these proactive solutions to these chronic things that we can get out in front of and just teach you some simple things that you can apply to your daily life.
Great. Being proactive is so important. So I want to thank you, Keith, again, for being on the program.
All right. Thank you for having me, Debbie.
Oh, my pleasure. And I want to thank the Quincy Health Department for continuing to sponsor Aging Strong. Until next time, everybody, be well and keep safe. Bye-bye.